Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to this episode in the AMA Steps Forward podcast series. I'm your host, Dr. Kevin Hopkins, a family medicine physician at Cleveland Clinic and physician director of health system engagement here at the AMA. A common topic discussed on this podcast is physician burnout. The team responsible for Steps Forward content, the Debunking Regulatory Myths series, the AMA Organizational Biopsy Survey, Joy in Medicine Health System Recognition Program, and many other tools and resources is the AMA Professional Satisfaction and Practice Sustainability Group. Our group aims to remove obstacles that interfere with patient care, promote physician well-being, and prevent and mitigate physician burnout. We strive to help create the conditions where joy, meaning, and purpose in our work are possible. Most of us are probably aware of the adverse impacts burnout has on everything from the safety of patients to the financial performance of a health system. The negative impact of burnout on physicians includes our personal relationships. Physicians with symptoms of burnout have higher rates of divorce and infidelity and less meaningful relationships with peers, friends, and family members. Burnout's associated with higher rates of early retirement and decreases in work commitment. Burned out physicians are more prone to self-harming behavior such as getting inadequate sleep, alcoholism, and prescription drug abuse. It's estimated and widely reported that in the U.S., between 300 and 400 doctors die by suicide each year, a rate more than double that of the general population. I'm joined today by our guest, Dr. Gino Somers, Chief of the Department of Paediatric Laboratory Medicine and Physician Lead for Wellness at the Hospital for Sick Children. SickKids, as it's corporately branded, is a major pediatric teaching hospital in Toronto, Ontario, Canada, affiliated with the Faculty of Medicine of the University of Toronto. Thank you for being my guest on the podcast, Dr. Somers.
Thank you for having me, Kevin.
It's a pleasure. So, Gino, before we get started into our topic for the day, would you mind telling our listeners a little bit more about yourself and your background than I was able to describe in the intro?
Sure, yeah. I graduated from University of Melbourne and Monash University, which are both in Melbourne, Australia, and came out to Canada to do a fellowship many years ago, and I stayed. I've been in medical leadership roles for just over 10 years now, and over those years I've learned a lot about leadership, but more importantly, I've learned things about myself. And one of the things I realized was one of the passions that I have is helping and supporting other physicians through their careers, because it is a challenging career in healthcare. So my journey into wellness began, I would say, around 12 years ago. I remember being interviewed for a leadership role, and one of the questions was, what do you want to bring to the role? And my answer was that I wanted to foster a positive and productive environment. And back then, wellness really wasn't in my vocabulary. I didn't realize that there was such a thing, but I knew that that was the type of leader I wanted to be. And ever since then, that's something that really drives me. I want to have a positive environment because I know at the end of the day, that's good for all sorts of healthcare priorities. If you have a positive environment, I think your staff perform above and beyond what they normally would. And it wasn't until 2018, Kevin, that I really had a formal role in wellness. And that was when I joined the peer support team. And the peer support team was comprised then of a small number of physicians. And I did that because I was going through a difficult time myself, and I reached out to peer support. They helped me very impactfully. It was a great positive experience for me. So I thought I'll pay it forward and I'll join the peer support team. And that was great. But I realized that I thought instead of fishing people out of the river, why don't we get at why they're jumping in the river in the first place? And that's what put me on the path to wellness. Let's be more proactive. Let's put in some guardrails, support, so that physicians have that ability to reach out and work in an environment that brings the best out of themselves. So very pleased that I discovered wellness. It is a passion of mine. And my motto is practical solutions.
Well, thank you for sharing. And I know we'll probably get into more of your personal experience and background as we go through our conversation today, Gino, but those comments really resonate with me. You're right. If we look out for each other and we look out for the people that are part of our practice, part of our organization, everybody's better off as a result, including ourselves and our patients and everyone in between. And so thank you for sharing that. Do you feel comfortable sharing more about your personal experience of difficult times throughout your career and sort of the ups and downs that come with that? Because as you were mentioning that, I heard some things that remind me of my own experience. And I also talk about how a career in healthcare is difficult. If it were easy, anybody can do it, but it seems like it's gotten increasingly more difficult over the last couple of decades. And at least that's been my experience. Is that yours as well?
I think so, Kevin. I think expectations are incredibly high now that the level of service we deliver is top notch all the time. And I think that is a real change that I've seen over the last several years. And looking back on my career, I can see several times where if I wasn't burned out, I was really close to it. I just didn't know what it was at the time. There's one particular instance that stayed with me, and that was when I was a junior staff. I was doing, at that time, autopsies, both hospital consented autopsies and coroner's warranted autopsies. And the coroner's warranted autopsies are also known as forensic autopsies. And I remember coming in one weekend and doing a forensic autopsy on a young boy who'd been killed in a car park on a wintry December evening. He'd run out between rows of cars and was struck by a vehicle. And I came in and the police were there, which is usual in this type of circumstance. There was nothing unusual about that. And they handed me a DVD and they said the accident had been captured by the CCTV cameras in the car park. Could you please look at the type of impact and correlate it with what you see when you do the postmortem? And I said, sure. And I took the DVD and I remember plugging it into my computer and waiting for this accident to occur. I didn't know when it was going to happen. And I think they were probably the worst 2 or 3 minutes of my life, just waiting to see this young boy tragically killed and then seeing the parents and their reaction. Anyhow, I saw the DVD, I saw the accident, I went in, performed my autopsy, and usually I was really good at leaving work, turning off and going home and being at home and being fully present. But I found after this, it was much harder for me to do that. This stayed with me for weeks, even a few months. And I had trouble sleeping. I couldn't turn off. I felt like I was failing. I didn't think I was turning into the type of physician and pathologist that I really wanted to be. And luckily, I had a supportive division head who was able to give me a little bit of time off, which is what I needed. But that really stayed with me. And I think that was really the start of me wanting to pay it forward, to help other staff who have similar difficulties and challenges, that we all face during a career in medicine, to help them realize that if you react strongly to negative circumstances, strong emotions, it's not abnormal. It shows you're human and compassionate. And that was really something that stayed with me. And I still look to that when I reach out and help other physicians.
Wow, what a traumatic event. And, until the last 10, 15, 20 years, that the possibility of that occurring, catching an accident or an incident on video to be able to see the mechanism of injury, like that just wasn't possible. It for sure wasn't common. And we're used to sort of seeing and hearing about traumatic things when we sign up for a career in medicine, but to see it and to see obviously the results, particularly involving a young child right in front of you on the table, seems particularly difficult. And I can't imagine what that must have felt like.
It was challenging for sure.
Other than time off, what do you think helped you come back from that? Because I heard you say I wasn't turning out to be the type of pathologist that I thought I should be. And it, makes me think of like some symptoms of imposter syndrome, that I'm not what I should be. I'm not who people see that I am or think that I am on the inside. What do you think helped you get through that and get back to being able to function day to day in your role and obviously succeeding in your career?
Very good question, Kevin. It took me several months to, get my perspective and my balance back. One of the things that really helped me was I read around the same time, I read about a British forensic pathologist who wrote an article about his struggles with burnout and PTSD. And he said that a career as a pathologist, which is obviously what I was, a career as a pathologist is incredibly challenging. And what we do is emotionally impactful and can be psychologically traumatizing. And he was brave enough to actually write these articles and normalize these reactions. And I think for me, hearing someone else in forensic pathology world, this pathologist was quite well known. And for me to read that from someone with such stature made me feel like, wow, I am normal and I am actually turning into the pathologist that I want to be. I'm not losing that compassion. It's in fact the opposite. If I wasn't feeling like that, I think I wouldn't be the compassionate physician that I am today.
So I mentioned in the opening, Gino, about some of the negative impacts of physician burnout and how it affects us, how it affects our patients, our health systems, all of that. Have you experienced or seen in your leadership or peer support role particularly difficult consequences and outcomes as a result of physician burnout? And what was that experience like for you personally and professionally?
Yes, certainly I've seen the effects of burnout on my physician colleagues, and as a peer supporter, you do tend to see, the effects of both an acute situation, say an unexpected outcome or a patient death, but also I think what's even more common now is the cumulative effects of stresses. And we saw this particularly during COVID. There was a lot of chronic stress, people dissatisfied with the responses, with the measures being taken, moral injury, moral distress. All of those things were really amplified during the pandemic. And unfortunately, one of the things that was also amplified around the early time of the pandemic was physicians' reactions to this chronic and I guess this huge acute stressor that was COVID at the time. And within our academic network in Toronto, we did unfortunately have two physicians who died by suicide around that time. And me being peer supporter, I reached out to my colleagues who were affected, and I saw firsthand the devastating effects this had on their physician colleagues, on their friends, and the medical community as a whole. I think this was something we all felt, incredibly deeply. These was such tragic events, and that was, I think, the hardest thing as a peer supporter for me to face the death of our colleagues.
So, Gino, I imagine talking about the loss of a colleague or even an acquaintance, or maybe even somebody you didn't even know, but it's still very hard once we're removed in time and space. But it is so important for us to learn from these incredibly difficult experiences. Are you able to tell us any more about what your experience was like serving as a peer supporter, working with colleagues and coworkers of these physicians who were lost?
It was a really difficult time. You could imagine it's early in the pandemic. We were incredibly busy, and to have these tragic events happen, speaking with colleagues and close colleagues of these people, it really was shock and disbelief. And I think anger as well. There was anger that here we are, the caring, compassionate profession, yet this still happened. And I think people really had trouble coming to terms with that. That could happen in our profession. To me, it was really a difficult time, certainly lots of strong emotions. But what came out of it in the end was, okay, we need to provide better supports. We need to try and look into, what's the best way to help mitigate the factors that led to this in the first place. So it was, as I said, a very difficult time, but some good lessons in the end were brought forward.
So I can imagine, Gino, that going through that experience, especially playing a significant role as a peer supporter, would influence your personal and professional approach to physician well-being. Is that safe to assume?
Absolutely. I think that one of the things that I sat back and thought about during all of these tragic events was, if I was the leader in this situation, how would I handle this? How would I be able to cope with a physician suicide? What would be my approach? And I realized that peer supporter or no peer supporter, as a medical leader, I really didn't know the first thing about what should I do, who should I contact, what can I say, probably more importantly, what shouldn't I say, and what's the time frame. So I came out of this thinking, yes, we need to have a much better physician support system, and it really cemented my belief in physician wellness. But I also came out of it sort of thinking on a practical level, okay, I need to know more about this. How do we approach it? If this tragic event were to happen again, how should we approach it in a more coordinated fashion?
And certainly now, I think there's more awareness of this situation. I mean, I think of the Dr. Lorna Breen Heroes Foundation that sort of came out of the tragic loss of Dr. Lorna Breen in New York City as a result of the COVID pandemic. But unfortunately, this stress and burnout epidemic pre-existed the pandemic, and it hasn't necessarily gotten better. So were there available tools and resources that you found that you could go to that were helpful during this time?
So I remember at the time, I did what probably every physician would do, and I looked for resources online. I thought there must be something out there. And I typed in after physician suicide, and the AMA steps forward after a physician suicide toolkit was literally the first thing that popped up in the search. And I opened it, and it was an incredible resource. It not only answered all the questions that I kind of listed just before, but it answered questions I didn't even think to ask. It was written in a really orderly, easy to follow format, and it really laid out the events that should happen after a physician suicide and who's accountable. And I felt that this was the resource that we needed. It was full of really good information, and it certainly helped me form a much better idea as to what we needed to do, as I said, if this tragedy were to happen again.
How did you take that AMA Steps Forward after Physician Suicide Toolkit, and were you able to take it and somehow customize it for use amongst maybe your team or for your specific situation?
Absolutely. It's a really good question, because it is a great toolkit, but it is 24 pages long. And I wanted to make it more sort of digestible for our leadership. So the first thing I did, Kevin, was I fashioned a one-page executive summary that really distilled all that wonderfully rich information in the document into one page, so that, in the heat of the moment, our leadership could read it and understand what the steps were. The next thing I did was list the members of the crisis response team. And the crisis response team, there's certain people you need in that team. So I named the crisis response team, but I used terms that were familiar to SickKids leadership and were relevant to our org chart, so that it was tailored for SickKids. And I think the next piece, which is the most important piece, almost the second third of that executive summary, was the sequence of events over time and the accountabilities. And again, putting that into 24 hours, days to a week, and then the weeks and months following, and then who's responsible for each one of those events. For example, reaching out to the family initially, reaching out to the family after a few days, planning some sort of memorial, and having exactly who's responsible for that, I think, makes it much more usable and practical. And the final piece that I put onto that one page were references to what I saw as essential resources in the toolkit, in the document. And that included a 24-hour checklist, which I thought was just phenomenal. That's where everything's happening at once, and you've got it all laid out very clearly as to what you should be doing to follow up such a tragedy, and things like how to memorialize someone. It even has scripts. What should you say in this circumstance, and what should you say to this group of people? So all of that on one page for the executive summary in language they understand that's relevant for SickKids, and then having it there in preparation, I think really made me much more comfortable with our ability to face such a tragedy if it were to occur.
Yeah, that's great. Great examples of how you were able to customize that other than just the length of the content. There is a lot there. And so how do you digest it? How do you share it easily and readily? So thinking about a one-page summary is really valuable. And then I really liked how you mentioned the timeline of steps and events that are recommended. And then also defining responsibility is a really key step to take to make most effective use of a toolkit like that, it seems. Were there any challenges that you faced while implementing the recommendations from the toolkit other than just adapting it to your own organization?
I think the only challenge I had, Kevin, was what are the most important pieces to put into that one-page summary? And looking over the document, there were certainly pages and references that stood out for me that I thought was necessary for our leadership to know in the moment. I think the other pieces they could have looked at, over a longer time period. I mean, it's been received very positively, so I've not had any challenges from a point of view of the leadership thinking it's a good idea. Thankfully, we haven't tested it yet, which is a very good thing.
Yes, a great thing to be sure. And I heard you sort of in passing say something about the value of having a tool available to use before it becomes necessary. Could you explain and unpack that a little more? Why is it beneficial to have a plan of action available, sort of ready to go before a physician suicide potentially occurs?
Yeah. I think that there's a number of reasons. Firstly, and we kind of touched upon this, is having it there so that you're not scrambling to come up with a plan in the hours or days following. Having it ready to go right from the outset is, I think, a much better approach for obvious reasons. I think, too, one of the other reasons is one of my colleagues on a provincial working group looking at physician suicide on which I sit said that a good postvention is prevention. So I think if an institution has a orderly, clear, and transparent approach to this type of tragedy, it really does help the greater medical community. It reduces stigma, it allows conversations around this, and it really opens up possibilities for people who might be struggling to come forward and feel brave enough to talk about this type of thing. So I feel like it's also prevention in a way, having a really good approach. And finally, the great thing about having this resource is it's future-proofing the process. I'm not going to be wellness officer for forever. Our leadership's going to change. Staff is going to rotate through the hospital. But having a document with clearly written instructions, I think, means that it's available for many years to come.
Yeah, and I really appreciated what you said about having something available because those first 24 to 48 hours are so critical. You don't want to be, like you said, scrambling to try to figure out what to do next, even though you may be. And, maybe it's a colleague who's very close to me personally, and so thinking about that to have something somewhat packaged that we can pull out and use if needed can help us organize thoughts and prioritize next steps in a time where it's going to be potentially very challenging to think about it rationally, right? Because of the emotion of the situation. And while we're talking about, obviously, we want to prevent physician suicide, the fact is that it's been a pretty prevalent issue. And so for most of us, if we haven't experienced loss of a physician partner in this way, then there's a high likelihood, unfortunately and sadly, that it may happen at some point, right? So while we're on that topic, what are you think keys to look for in colleagues and coworkers that should cause us to ask questions about their well-being in order to help prevent something like this from occurring?
Oh, that's a very good question, Kevin. I think the one thing that I've noticed in my years as a peer supporter is, if you notice a change in behavior, if someone suddenly isn't as engaged as they used to be, or isn't speaking up, or is turning up late, as a change in practice of how they usually perform, I think there's some danger signs there. It's the classical emotional exhaustion, cynicism, reduced professional efficacy, and look for signs of burnout. I think one of the things that really starts to ring alarm bells for me is a rise in cynicism. I think that's one of the most prevalent signs associated with an increased risk of burnout. And once you start seeing that, people turning off, people really not engaging, that's something you need to be aware of. And as leaders in medicine, and as physicians, we're all leaders to some degree. I think it's our role to really look out for each other and reach out and just ask, check in, go down and get a coffee and have a chat.
Great advice. Thank you. And I know we can easily get so consumed in our day-to-day work and our busyness that we forget to be observant of the people and situations around us. And yet, it reminds me of sort of what all the security experts say. If you see something, say something, and we should be doing that for one another too. So thank you for that. Is there any other advice that you would like to share for others who are helping to support physician wellness?
Yes. And I come at this from the point of view of, this is what I should have done. This isn't what I did do. I wish I'd known this when I started. But I think, to me, when you're starting out in physician wellness, be it at a team level, departmental level, or an institutional level, there are three things I think that you really need to make it a success. The first thing is you need support from your leadership. I'm lucky. I have a very supportive chief medical officer who values physician wellness and sees it as a necessity. Even as we're moving away from COVID, he sees that. So I think you need to foster support within hospital leadership. And, sometimes it's not the formal chain of communication, but there's always someone in the executive who's very supportive of wellness, and that's the person you need to collaborate with. The second thing I think that's really important is you've got to have a good understanding of your institution's needs. Wellness is the issues with wellness and burnout. The concepts are very similar across many North American institutions, but there are specific institutional needs. There's certainly things at SickKids that are different to, say, the Mayo Clinic or the Cleveland Clinic or Children's Hospital of Los Angeles. You really need to have that institution-specific knowledge. And the final thing I'll say, for someone entering the wellness sphere is reach out and form good relationships with other departments like legal and human resources, occupational health and safety, finance, because they're the departments that you're going to need to collaborate with when you start to institute those changes to improve your physician's wellness.
Yeah, great advice. So ensuring support from leadership, understanding institutional needs and culture, and then fostering relationships across departments and key stakeholders to have success. What else? Any other pearls of wisdom that you would find valuable to share with our listeners?
I think speaking with other wellness leaders at different institutions, to me, has been incredibly positive and affirming. It's almost like group therapy. It is a difficult task. And I feel like it's something that reaching out to others and talking with them really does help feel you for the challenges that might lie ahead. The other thing is, I find that one thing that I walked away, I did the Chief Wellness Officer course at Stanford, and Tate Shenefeld, his last talk was how to survive as a Chief Wellness Officer. And he put up 3 slides. And the first slide said, you can't fix everything. The second slide said, you can't fix everything. And the third slide said, you can guess, you can't fix everything. And to me, I remind myself that every day, that you can't fix everything. It's impossible, but you can certainly focus your efforts with a great team.
Yeah. So poignant, really, because you think about most physicians, we're fixers by nature. We want to fix it. We want to make it better. And there's just some things that we can't fix and that we don't necessarily have to fix. And we get caught up in that type of mentality. And really, we should just think about progress over perfection. What's the next right thing that I can do to take a step in a positive direction towards personal, individual well-being and organizational, institutional well-being? So thank you, Dr. Somers, for your willingness to share your experience and wisdom and all the things that you've learned as a result of your experience. Dr. Gino Somers, physician lead for wellness at SickKids in Toronto, Ontario, Canada, has been our guest. The 988 Suicide and Crisis Lifeline provides free and confidential emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week across the U.S. Call or text 988 or text TALK, T-A-L-K, to 741-741. Be sure to check out the episode description to explore the related resources. And until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.